Hello, thank you for joining our webinar, Operational Strategies to Drive Healthcare Profitability. My name is Elisa Lesser, and I'll be moderating today's session. Before we begin, I wanted to let you know that this session is being recorded, and a copy of the playback and slides will be sent out in the coming days. And if at any time you have questions for our presenters, you may ask those through the Q&A panel. Be sure to direct those questions to all panelists using the drop-down menu, and we'll answer those questions at the end. I'd like to now introduce our presenters for today. We have Jill Villalobos, who is a former nurse and healthcare operations director and executive. As a senior clinical sales engineer at MediAnalytics, she leverages her past experience to guide hospitals, health systems, and physicians in using analytics to optimize their revenue and quality of care. We also have Hina Sapori, who is the product owner of MediAnalytics' cost and operation solutions. She plays a key role in the development of the solutions and their successful deployment to our clients. I'd like to now turn things over to Hina, who will start us off. Hina?
Thank you, Alyssa. Hello, everyone. I am Hina Sapori, and I will take over from here onwards. In today's webinar, we will go over some of the challenges related to healthcare spending, followed by the areas where cost transformation is needed in the healthcare systems. We will then address the ways in which healthcare systems can ensure profitability and performance. And at the end, Jill will walk us all through the cost and operations product suite demo, and then we will address the questions and answers from the participants. Going to the next slide. Here, we can see that last year there was a survey conducted by Navigant in which they showed that in year 2018, average supply chain spending of hospitals across US increased by 10.2% than necessary as compared to year 2017. In terms of dollars, if we take into account individual hospitals, this essentially means that on an average, there's an opportunity to save about $11 million in hospital supplies. Well, when we talk about dollars and savings of 11 million a year, it essentially means that it is equivalent to building 2 outpatient surgery centers or salaries of 160 registered nurses or even salaries of 42 primary physicians. Indeed, we need to think about necessary supply spending in hospital systems to increase their revenue. But the question arises, is that the only area where we need to improve? Going to the next slide, we can see that there's another survey that was conducted in year 2018 in which 190 hospital systems filled in their primary focus of cost transformation effort. As you can see in the bar chart, it is not only surprising to see that, as always, the traditional priorities dominates attention, while the contribution towards changing the foundational cost structures are always being addressed aggressively. 72% of hospitals and healthcare systems cite traditional labor productivity and supply chain and other non-labor costs as key focus areas, while we are neglecting the physician enterprise management, service rationalization, or service line initiatives and clinical workflow designs somewhere there, and we are not even focusing on those areas. So we believe that every hospital system wants to improve their costs, but what is the thing that is stopping them to do so? In our next slide, we can see that in the same survey conducted by Kaufman Hall, the challenges that are related to having this cost transformation goal or implementing these cost transformation goals majorly concentrates towards the lacking of data and insights into the cost where the saving opportunities exist. So most of the healthcare systems are actually not aware of the reliable data process. They are not aware of how they can leverage analytics and the tools to get low cost reduction goals, to lower their cost reduction goals. So in order to succeed, we have basically analyzed and reported few of the tools or few of the measures which we can use and which we use as part of our cost and operations suite. to give a better cost transformation goal. So in our next slide, through all what we have learned so far from our past experiences with our clients, we have incorporated all the best practices of cost transformation of healthcare systems into our cost and operations suite, and we have divided them into 3 parts. So healthcare systems can win by improving per case profitability. Secondly, by optimizing throughput of important assets. Third, by strategically investing in the right service lines. When we talk about this, we can see in the next slide, our best practices are our product suite that we have to offer. So in this, we have listed some of the best practices that are incorporated in the cost and operations product suite to ensure profitability and performance. As we all know that operating room is fixed resource, which limits the number of procedures performed by the hospitals. So failure to optimize these operating rooms could be a difference maker in the profitability of enterprise. From our previous experiences, we analyzed that in order to achieve OR optimization, an analysis and evolution of OR throughput data, turnover time, or OR utilization is very, very important. For instance, if we are able to eliminate the time wasted between 2 procedures and keep a track of on-time start cases, we can reduce our turnovers. Another feature that we think is helpful in increasing the performance is block utilization and room utilization analysis, as it reveals the opportunity for improved scheduling while also leading to greater transparencies and physician engagement. So what are we getting with the analysis of OR throughput? We are essentially getting shorter surgeries, quicker room turnover, more reliable scheduling, more surgeries to be done with the same or fewer resources, thus which will help us increasing our cost optimization. Going to the next slide. While working with some of our clients on our throughput analysis, we also realized that the second best approach to ensure profitability and performance is emergency department efficiency. Emergency department is the source of approximately 30% of hospital inpatient admissions, and timely care is important to ensure that we have best outcomes. Patients leaving in frustration for long wait times are missed revenue opportunities, and no one wants that for sure. Thus, making it important for us to analyze that ED volume and revenue by location and procedure diagnosis is something that we should take care of. In terms of patient flow, timestamps, it was hard for many of our clients to determine how they can track and analyze timestamps through the data that they have. So the way we ensured that we can measure this is that we made timestamp-based metrics to identify the bottlenecks in each step, from patient triage to in-room to provider, till the time patient goes into the phase of decision time and departure from the emergency department. This definitely ensures more transparency in the process, and the visualization of census becomes way too easier. So as part of our product, when we move to the next slide, we can see that we have attached the screenshots here. On the left-hand side, you can see the leadership dashboard. That is one of our dashboards in our emergency throughput product, which gives us insights on the visits, patient flow, the occupancy of emergency department at the time of arrival of a patient, through graphs and charts in tabular form. And on the right-hand side, you can see OR dashboard, which is the operating room dashboard scorecard screenshots from surgical throughput, which shows us the volume trends, on-time starts, same-day cancellations, all in the form of facts and figures, so that it is helpful for the executives and the analysts to analyze how they can measure these reports and get a better outcome. So as of now, I'll be just going through this one. This is just a screenshot, but at the end of the demo, Jill will go through these reports in detail and show you how these reports work. So going to our next slide. Labor productivity is another best practice that we think can improve hospitals in gaining their costs insights. So labor productivity pairs payroll hours and dollars to unit services, such as nursing hours, per day patients, and it allows the hospitals to investigate inefficiencies through the lens of cost of labor, skill mix, overtime dollars, and utilization of expensive contract or as needed labor. So we believe that as some of the value drivers to include labor productivity are saving money by reducing overtime, ensuring correct staffing or skill mix is being used, and reducing the costly contractors or agency labors. But what do we need to do that? What are the use cases? So in order to figure out that, we find and address, it is better that if in the data we find and address the unproductive department with excessive FTEs so that we can remove them. Compare FTEs to earned amount based or actual volumes, reduce the expensive overtime and contract labor, and right size skill mix ratios so that we can keep the accountability of the budget that is being used in the labor department. In our next slide, in the labor and productivity analysis reports, you can see that we have just attached a sample report here, which is the screenshot of department dashboard. It basically gives us labor productive. Basically, here tells us about the department and nursing managers, and it gives them the insight into the productivity of their employees. The solution provides them the analysis of excess FTE, as you can see here, the productivity percentage, labor expenses per period, and the unit of services, etc., and how they can optimize these numbers and improve the costs and labor production. So along with this, we also have scorecards that help the line managers in keeping them accountable and align the organization goals with the enterprise strategy. At the end of the slide, Jill will go through these scorecards in detail, and then she will help you understand more how this works. I'll hand over from now onwards, I'll hand over the next slide to Jill. Thank you.
Thank you, Hina. One of the things that we know that drives cost and inefficiencies in health system organizations today is variation in service line performance. And so as we've worked with clients and listened to their struggles around service line variation and profitability, we utilized that feedback and incorporated it into our solution to be able to help clients and others gain insights into where that variation exists so that decisions can be made about how to eliminate unnecessary care, thereby reducing costs, how to eliminate or minimize the variation between practitioners within a given specialty by comparing physicians on apples-to-apples metrics and identifying best practices that can be shared across the system. This slide gives an example on the right-hand side of one of our scorecards. Again, we'll cover this in more depth in our live demo towards the end of our presentation today. But insights into service line variation and performance are all around getting detailed insights around specific procedures, including trends related to specific DRG performance, identifying the return on investment opportunities in practice variation or minimizing practice variation through the standardization of care towards best practices, and then engaging physicians in collaboration around their performance, which is easier to do when you have data to share with them and engage them in dialogue around what the data shows. One of the key struggles that we've heard many of our clients talk about dealing with is the struggle over managing supply spend. And so there are key insights incorporated into our solution that help address that struggle and identify where you have opportunities to improve adherence to group purchasing agreements, where you might have some opportunities around the invoice costs being higher than the purchase order agreed upon costs, and various other pieces of data that help you understand vendor by vendor where you have opportunities to improve your supply chain management and create efficiencies that reduce your cost and improve your overall margin. This is an example of the scorecard that we'll take a look at later in the demo. This solution does help you address the struggles around supply chain by helping you identify where overpayments have occurred. It's a very common problem that we see the invoice costs being higher than the purchase order agreement, and having visualization of that helps you address that with those particular vendors. It's also easy, we found, by listening to our clients, for individual departments to go off their purchasing agreement contracts and order from vendors that aren't part of those agreements. So their pricing is higher in most cases. And being able to identify that and then bring those departments back in line with the group purchasing agreement vendors helps to reduce costs overall and improve your agreement negotiation with that group purchasing contract. So the solution that we'll see in demo today with cost and operations really addresses many of the struggles that our health system clients have talked to us about. Those traditional struggles of supply chain management and labor productivity efficiencies, along with the more transformative struggles that our clients have talked to us about when it comes to maximizing throughput in emergency departments and ORs, as well as managing and reducing the variation in service line economics. We've also incorporated these solutions in with our enterprise performance management platform, which allows you to take your health system strategies and identify the tactics to help you address or meet the goals of your strategies, and track accountability down to the department leader or organization leader that's responsible for meeting the goals related to supply chain or service line or ED or OR throughput or labor productivity strategies. Some key takeaways today: we want health systems to be able to focus less on volume and focus more on reducing costs and improving performance through efficiencies that are gained. We hope that participants understand that a top reason for failure to achieve the cost transformation goals is a lack of good data and good insight that helps you identify where those opportunities to maximize revenue and improve efficiencies exist. We believe, and we've found through the work that we do with our clients across the country, that analytics plays a key role in pinpointing areas of opportunity and areas where there's greater room for efficiency and less variation, and identifying those areas where we can help to create operational improvement, whether that be in the ED or operating room, or if it comes to improvement opportunities in terms of labor productivity statistics, or reducing that service line variation, or improving the overall management of your supply chain. And an integrated analytics approach, integrated, as I said, with your overall organizational scorecard to track measurement and improvement across the enterprise, we found is key to being able to hit your transformative operational goals. I'm going to switch now our conversation to a live demo. As we mentioned during the course of our presentation, Hina talked about our dashboard view for emergency room throughput, and you'll see that we've captured what our clients have told us are key metrics around the management of an emergency department. So everything from ED visits, as well as the acuity level of those visits, to the important metrics around patients who are leaving AMA or leaving without being treated, and being able to trend that both over the last week as well as a rolling 3-week or 4-week period, and then year-to-date compared to prior year-to-date and the variance. So you can monitor and watch your trend performance over time. We've also captured the timestamp metrics of the average length of stay in minutes of patients in the emergency department, as well as the metrics around a patient's arrival to triage, arrival to being seen by a provider, and then that provider's decision to how quickly the patient is able to depart the ED. We've taken a look at how many visitors to the emergency room end up being admitted, and then what their admission length of stay is, as well as how long it takes to get a patient from the ED into a bed once the decision to admit that patient has been made. We know that that bed management process can be burdensome for a lot of our health systems, and being able to light up data for organizations to be able to monitor, track, and address that struggle has been key for many of our clients. We also manage or have incorporated insights around the census. So within each of these, you're able to see what the average census has been compared to max capacity and compare that performance over time. One of the other insights around emergency department management is the identification of patient acuity levels, as well as their typical presenting complaint and their outcome. So how many patients left AMA or left without being treated, how many were transferred or discharged, and then how many were admitted. And for our health systems, you can compare facility to facility within the same system. Our solution also allows for dynamically just evaluating the performance of one facility within your system. So as you select, in this case, we'll say the Crawford facility, all of the data on the dashboard then changes to reflect just the performance of that one facility. So you're able to see the changes in acuity. So Crawford sees a higher percentage of acuity level 4s and has a higher number of patients that are discharged or transferred compared to other facilities within the system. We're also able to monitor that performance by day of week or time of day. So you can really start to gain insights around if there's a particular day of the week or a particular time of day when more patients are leaving without being treated. And then you can drill down into the reasons why that's occurring, if it's a staffing issue or a provider issue or what it might be, that then helps you create additional efficiencies. If we switch to surgical throughput, the report that we will look at is our OR dashboard. And standardly out of the box, our solution provides multiple reports and dashboard views that our systems have and clients have helped us to build that provide insights and light up opportunities for you right away out of the box. So as we look at our OR dashboard, you're able to look at actual cases compared to schedule and look at cases per week, and then trend this again over time. You'll see the trend line captured over here. This is for half a year period. If you want to trend that by day of week or by time of day, our solution also allows for that visualization as well. And then key metrics that Hina talked about were those room turnover metrics and room utilization metrics, as well as on-time starts. So you're able to really drill down and monitor those important metrics, again, by day of week, by time of day, to see if there's a particular OR room, a particular OR team, a particular specialty that needs or has opportunities to improve their efficiency and their ability to have more on-time starts. If we move to our labor productivity views, we have a leadership dashboard for this area of performance. So you're able to identify whether productivity issues are system-wide or related to one particular department. And then within that department, you can identify if it's one particular employee or group of employees that might be having more overtime. So within a department, you might find through the use of data analytics that it's one or two particular staff that are driving all of the overtime results for that particular department. So rather than addressing it as a whole department issue, you can address the staff that are driving the bulk of the results and improve your overall performance. One of the things that I know organizations I've been involved with have always struggled with is around service line variation. So variation in performance and practice across specialties, but also within a given specialty. And so one of the views that we've provided takes key metrics, so admission, outpatient visit volume, as well as case mix index and average length of stay, and then captures charges, readmission rate, and mortality rate. These are key metrics we've found in working with physicians across the country that are important to them in understanding how they compare to their peers. And it's been helpful for administrators to be able to work with physicians and collaborate with their physician base to say, these are case mix adjusted results that show how you compare to your peers within the same specialty. So when you have a best practice physician, you're able to recognize them for that performance. And when you have a physician that has maybe some opportunity to improve their performance, whether that's in terms of more appropriate charging, or whether that's in terms of seeing more patients on an outpatient basis, or identifying ways to reduce their readmissions, you're able to have those conversations based off data. And finally, our supply chain views allow you to gain insights vendor by vendor. One of the key areas of opportunity our clients have talked with us about is this adherence to group contract usage. I know from my past experience, it's very easy for an individual department leader to have a great working relationship with a particular vendor who may or may not be a vendor that's included in that group purchasing agreement. And without data to capture when departments go off contract or off group agreement, it's very easy for that to drive increased cost in your supply chain management without being able to identify why. And our solution certainly helps you address the struggle of supply chain management through this metric, as well as through the metrics around invoice spend compared to purchase order spend, and identifying opportunities where there have been overpayments. So you're able to identify these exact invoices where there's been an overpayment simply by drilling down. And then it gives you the list of each of those 19 invoices, and you're able to work with those particular vendors to say, hey, you charged us more on the invoice than what we agreed to pay on the purchase order. And then you can talk about refund or further business and contract opportunities with that particular vendor. I'll pause now and allow time for questions.
Great. Thank you so much, Jill and Hina, for sharing your perspectives. We'd like to now take time to answer any questions that you may have. And as a reminder, you can submit your questions on the Q&A panel, and be sure to submit those questions to all panelists with the drop-down menu. So we have one or two questions in the queue, which I'll go ahead and ask, and Jill or Hina, whoever would like to answer those, feel free. So the first question asks, or is, what have been the biggest barriers to improving throughput in the ED and OR, and how do the insights from analytics help overcome those barriers?
Hina, would you like to take that one from your experience working with our clients, or would you prefer that I take that one?
Yes, I can take that. So from my experience with our clients, I think the important part was most important barrier that they figured out was that they were not able to track the PD process measures, like they were not able to analyze how they can measure the patient flow and timestamps. For example, how would they know that if a patient is going from triage, or whether he is taking more time in room, or whether the decision of lab orders is taking more time? So in order to do that, we basically created certain reports in which we divided the reports in census time, and took arrival date time and divided it into 15-minute time slots, so that we can provide them accurate analysis of how we can measure the triage time, in-room time, provider time, and till the time the patient gets departed from the emergency department, so that we can tell them like what is the exact pain point, which area should they focus on, so that the patient can get departed before the time, or what are the areas or pain points where the patient is taking more time than usual. So yeah, I think this was ED patient flow and process measures were the major pain points of our clients in terms of the data that they had.
Great, thank you very much. Next question. What have you found to be the best approach for collaborating with physicians around service line variation?
What I found to be the best approach in collaborating with physicians is to have data, such as our solution provides, but to have data that's case mix adjusted. Physicians are very attuned and have been highly trained to take in data and make decisions and have analysis around what that data is telling them. So using data, especially when it's comparing their performance to peers, really has created, in my experience, a lot of engagement with physicians and a lot of robust dialogue around the ways that we can improve performance and identify top opportunities for creating efficiencies and spreading adherence to best practice and standardization of care.
Great, thank you, Jill. We have one other question at the moment. Our organization struggles with supply chain management. How can analytics help us overcome these struggles?
What I found to be most useful in my past experience with supply chain management is really, number one, to have analytics. So you have data that's objective, that helps you identify and helps you pinpoint where your key opportunities are. We know that systems all across the country struggle with supply chain management. Analytics helps focus that struggle and that energy a little bit to really pinpoint where the key areas of opportunity are. Is it that you have too much inventory on hand? Is it that you have too little inventory? And so when that happens repeatedly, then staff tend to overorder just to make sure they never run out again. And there are a lot more efficient ways to manage that throughput of supply chain. Analytics helps you do that, as well as the opportunities we talked about today in really identifying which departments do a great job of using vendors that are part of your group purchasing agreements, as well as which departments have some opportunities to improve their performance in that area. We know that there can be a significant cost difference for vendors that are part of those group agreements compared to those that are not. And so improving your performance in that area department by department has proven to be very key in helping to improve supply chain management.
Great, thank you, Jill. And that brings us to the end of our participant questions. If you do have any other questions at any point, please reach out to your MediAnalytics representative, or you can contact us from the link you see on your screen. Many thanks to Hina and Jill for presenting today, and to all of you for taking time to attend. We hope you enjoyed the webinar, and we look forward to seeing you on at a future event. Thanks, and have a great day.